Hello, everyone, and welcome to today's episode of Jump In with Jumi. I'm your host, Jumi, and this is BlackDoctor.org where you're watching. Usually I come on Thursdays, but it is Black Maternal Health Week, and it is such an important conversation that it requires 2 episodes this week. So you've got 2 chances to jump in and join in on this conversation about Black maternal health. With that being said, I realize that some of you have probably never seen me before. If you've never been here, you've never watched an episode. So let me know if this is your first time watching this. Let me know where you're tuning in from. Drop a waving emoji in the chat. Let's say hi to each other. Let's get this conversation really going. If you've seen me on Thursdays before, welcome to Tuesday's show. Thank you for sticking with me and coming to another engaging and exciting conversation. So let me know where everybody is tuning in from. Say hello. I'd love to welcome all of you new viewers and say hello to my faithful jumpers who I normally see on Thursdays. This is Black Maternal Health Week, and we as Black women are going into pregnancy so much sicker than our white counterparts in any other group. And we really need to do something about that. And so today we're going to talk about these structural inequities that have prevented us from getting the right kind of care. We're going to talk about some of the leading causes of maternal death in Black women. We're going to talk about obesity, gestational diabetes, hypertensive disorders, all these different things, like how to create a care plan that works best for all of our Black women who are going through pregnancy. So it's going to be a really engaging conversation. And what I'd love for you all to do is share this episode with everybody so that they can jump in and join in on this conversation alongside with you. So once again, let me know where you're tuning in from. Say hello. I see people from Brooklyn, from Chicago, first time from Virginia Beach. Welcome, welcome. So happy that you all are here. It's going to be a great conversation today. If you're here for the first time, you probably don't know this, but each week, each episode, I ask all the viewers a question of the week to really gauge what you know about the topic and just to get the conversation going. And today's no different. It's a special episode, but it's still the same kind of format. So my question of the week or of the day today is about what you know when it comes to Black maternal health. And here we go. True or false? High blood pressure and cardiovascular disease are 2 of the leading causes of maternal death in Black women. Let me know what you think in the chat. Is this true or is this false? Is high blood pressure and cardiovascular disease one of the 2 leading causes of maternal death in Black women? Go ahead and put your answers in the chat. Would love to get this conversation going. We are going to talk about this a little bit later. Make sure you've shared this. Do me a favor, share it with at least one person who needs to hear about Black maternal health, because it is now time to introduce our guest for today. Our guest is Dr. Michelle Ogunwale, who is she's an internist at Johns Hopkins Medicine. She also does a lot of health policy research. She's a research fellow. Her research focuses on clinical policy and community-based approaches to improving maternal health equity. Her research is focused on racial disparities in maternal health among African-American women, with a special interest in their experience within the healthcare systems and barriers to follow-up after pregnancy. Please join me in welcoming Dr. Michelle. Hello, Dr. Michelle. How are you? Welcome to Jump In with Jumi.
I'm wonderful. Thank you so much for having me and for creating a platform for this important discussion during Black Maternal Health Week.
Yes, it is Black Maternal Health Week. It is such an important conversation that we're going to have today. So thank you so much for jumping in. Please go ahead and tell the viewers a little bit about yourself and your work.
Absolutely. So I think you gave me a great introduction. I am a general internal medicine physician, which means that I take care of people with chronic medical conditions like high blood pressure and diabetes. And my work that I focus on is related to how do we make sure that women are as healthy as they can be going into pregnancy so that we can reduce pregnancy complications. And I also think about how we can improve outcomes after pregnancy. So it's not just about the pregnancy itself, but what happens after and how that can affect the next pregnancy if people choose to get pregnant. And if they don't, how pregnancy can really tell us a lot about your future health. And that's where I'm really focused in. I'm also a health disparities researcher or a health equity researcher, and I'm particularly interested in Black maternal health, which I think is a crisis in the United States, and how we eliminate disparities and eliminate the profound um, number of deaths that are happening for Black women and Black birthing people. And so that's where my work is focused. And in addition to thinking about these kind of chronic diseases that I spoke about as an internist, I also am very interested in racism and the role that that plays in pregnancy complications,
For sure.
and the mental health of Black people, Black women, Black mothers, and how that really affects not only our babies, but ourselves.
Ourselves.
And how do we move forward? And really, I think the last thing I'll say is a lot of the conversation is about racism, and we have to address those things. But part of my work is really thinking about, what about the beautiful parts of being Black and being Black women and Black mothers? What about our joy? What about our sense of community? What about our strength? There's all these beautiful things. It's like
It would be all of those.
being Black women. Yeah. So
Yes.
how do we lift those things up too in this conversation? So it's not just about, the negative, even though there is an urgent problem. But part of that is how do we get to our joy and our health, like our healthiest and most fulfilled life. That's what I am reaching for and dreaming for Black women. So
absolutely, I'm 100% there with you. So thank you so much for introducing and saying all of that. So let's kind of start though with maternal health. It is Black Maternal Health Week, and I know that it's just become a real big thing over the past few years, and a lot of people are really pushing for this education that it is an issue. And so what constitutes Black maternal health, a maternal death? What does that mean? And, the question of today, what are the leading causes of it? If you could start by talking about that, that'd be really great.
Yeah, absolutely. So pregnancy death, is we think about it as any death during pregnancy and up to 365 days after pregnancy, which I think not a lot of people are aware of. Some definitions say, well, the postpartum or after pregnancy period stops after 6 weeks, but the Centers of Disease Control define that period up to a year after delivery. And so any death that occurs during pregnancy or after pregnancy up to a year following is considered a maternal death. So
so up to a year is maternal death. It's not just like when the baby comes out, you're done. It's up to a year is maternal death. That is actually really important to understand. So what are some of the leading causes of maternal death, and how preventable are they? Are cardiovascular disease and high blood pressure two of the leading causes of maternal death in Black women?
Yeah, absolutely. And they are preventable. Some of these issues are preventable or highly preventable. And there's research that shows that. And I think so cardiovascular disease, hypertensive disorders of pregnancy remain leading causes of death for all women, and Black women in particular. The other things that we haven't really talked about here, but unfortunately, we see suicide and more recently, like opioid use or drug use as other contributing causes that we have to also think about, and think about what treatment looks like for those causes. And then
those are, just to touch on that, so those are causes of Black maternal death, the opioid use and the suicides, as well, in addition to cardiovascular
causes. Yeah, so those are general, like the top causes that you talked about. Definitely cardiovascular disease in general, high blood pressure and pregnancy. And I would say for Black women in particular, which I didn't mention on the top list, are pulmonary embolisms or blood clots in your lungs. So that's another cause, or blood clots in general. So that's another leading cause. But I just wanted to bring to light that issue that opioid use or drug use has been an increasing cause of death. And actually, when you look at the data, that actually isn't, or white women actually are more impacted by that than Black women, according to the data. So that is a little bit different. And the same thing, I think, with suicide and mental health. But some of those things that we think about, I am not sure. These are some of the questions that I'm probing in my research, or if we're underreporting that in our community, our issues with depression and mental health. But certainly from a disease standpoint, I would say cardiovascular disease, blood clots, and high blood pressure or hypertensive disorders of pregnancy.
So all things that can be prevented. So because your research is all about, health equity, social determinants, how do the social determinants and health inequalities contribute? How have they plagued women's health over the years? And what is being done to improve that and reduce these issues?
Yeah, absolutely. So, and just so everyone's on the same page, I think we talk about this word social determinants of health, or I think the language that you use is social determinants of health and equity. And what that really means, or the way that it's commonly defined, is it's just the where we live, work, and play, right? Sure. And how those things really affect our health. So things like our housing, the environment that we live in, the quality of the air, even our relationships with other people, all of those things are kind of they're things that are related to your health and they affect your health, but they're not directly disease. So that's what we talk about when we talk about the social determinants of health. And I think more recently, and actually, this is one of Dr. Joya Creer-Perry, who does a lot of work in Black Mamas Matter and the National Birth Equity Collaborative, wrote a paper, or collaborated or led a paper recently on that, on the social determinants of health and equities and what that means for maternal health. And I think your question was, what does that have to do with these disparities that we're seeing? And I think it has to do, I think it's a very, very big factor. When we think about health, we understand that there's so many things that come together that form whether or not you are healthy. And also, even when you think about disease, your ability to be able to work on that disease. I think those are two things. And so when we look at the risk factors for some of the complications that I talked about, so let's take hypertensive disorders.
Let's talk hypertension.
Yeah. So when you think about all of the things that we consider risk factors, so having obesity or overweight is a risk factor for hypertensive disorders of pregnancy. Having high blood pressure before pregnancy is also increases your risk substantially. Having diabetes also increases your risk. And you say, okay, well, what do these have to do with the social determinants of health? But all of these things that I'm naming also are higher in Black people or Black women in this conversation, right? And then when you take a step back and you say, well, why would high blood pressure and obesity and diabetes, which by the way, all kind of run together. So a lot of people who have high blood pressure might have diabetes, might have overweight or obesity. And so why would that be higher in our communities, And this is where you start to talk about this issue of structural inequity or structural racism that we talk about. Well, when we look at the things that increase rates of obesity, we think about things like fast food, not having access to healthy and fresh foods, not having places where you can exercise safely. And when you look at the history of this country and you start to think about things like redlining, which was a practice that tried to keep Black people and Black families out of certain neighborhoods. And you see that what happened back then was you got segregated neighborhoods that were less invested in where Black families live. And there's actually websites that map that kind of segregation to the health problems that are happening today. So you see that the neighborhoods where that segregation or that redlining occurred have higher rates of disease. And you say, okay, but why is that? We also know that those neighborhoods are less invested in. So there's less likely to be grocery stores there. We have something in research that we look at tree canopy, which is like just the covering of trees. And in neighborhoods, they're lower in those neighborhoods than other neighborhoods. The air quality is different in those neighborhoods.
So with somebody, I do want to touch on that a little bit, because if somebody's in those neighborhoods, right, like what can they do to improve their health? Like, because you can't change where you are, but there are things that you can do to make sure that it doesn't continue to negatively impact you. So what are some strategies that women who want to get pregnant, because we know a healthy pregnancy starts before you even become pregnant. So what are some things that people can do to combat all of their, living environment, essentially?
Yeah. So I'm going to answer this in two ways. The
All right.
first is that I don't think that structural racism is the job of Black women to solve. That's just like, I just want to say that. Um, we are victims of these problems,
For
right?
sure.
And so when we think about solutions, I don't think that it should require more labor from us.
Mm-hmm.
So that's one thing. But I also know that we live in reality.
Okay.
So I'm
Yeah.
going to give you an answer for that too. But I think that part of the work,
World is we don't have to deal with that, and it's not a burden on our shoulders, but we know
right?
we live. Yes.
Yeah, well, and I say that because the solution to structural inequities and racism are policy level solutions.
For sure.
And
Yeah.
actually, today, our vice president, and this is Black Maternal Health Week, had a roundtable discussion and why it's so beautiful and important to have representation and diversity and have her in office is because she has made this a priority and said that we need dollars and we need real change. So I will give you one example of that is I told you that the pregnancy period extends to 1 year.
Mm-hmm.
Well, ideally, you should be able to access care up to that first year postpartum. But Medicaid coverage, which is covered during pregnancy, which gives you access to health care, typically ends 60 days after pregnancy. So for women who all of a sudden had insurance because of pregnancy, now it's over. And yet I'm telling you that deaths are still occurring to 1 year.
Mm-hmm.
But there is legislation that we can pass to extend the Medicaid time to a year postpartum.
For
Those are
sure.
the things that our vice president is talking about. When I talk about people don't have access to care, and that's a structural problem. We know that Black people are more likely to be on Medicaid. So
Mm-hmm.
this is again, it goes back to these issues. So the way that we change that is to address a structural issue. But even within, I need to say that because I think it's important to
For
know
sure. No,
that
it's very important. It is
yeah,
very
that racism is not our job to fix because we're the Black people, Black women are victims of that, and so that's not our job to fix. But I did say that we are strong and we are resourceful and we have power in community. And I do think that there are things that we can do to still improve our health while we're living in the confines of these systems and while we are advocating for change for ourselves and asking that the systems change so that
Mm-hmm.
our lives will be saved. And I think some of that, and I know it does sound simple, but lifestyle changes are things that we can do. So, and let's say something like walking. So I
Mm-hmm.
think people have this grand idea about exercise that it has to be a marathon or like some, intense activity for 5 hours. But, every bit helps. And so even if you only have 5 or 10 minutes to do some activity, it's better than nothing. Even though we typically recommend 30 minutes.
Right.
Of
You
let's say
can exercise
walking
or you're watching
or
TV.
activity.
Yeah.
Yeah, 30 minutes 5 times a week, or you can do vigorous exercise, which is something like will get you out of breath, 45 minutes 3 times a week. But here I'm going to shout out my favorite organization. People think I like work for them, which I don't. But Girl Trek is a movement about getting Black women to walk for their cardiovascular health, which we talked about was a leading cause of maternal
Yeah.
death. Right? And the beautiful thing about that organization is that the idea pre-COVID and still now you can participate by listening to their walks if you want to listen. They have a podcast, but when we get in community and we walk together, things change. That is the legacy of Black people.
Mm.
And I love that walking is free
Yes, it
and
is.
it means something. Yeah, it's free, and it means something for our communities because when we walk, things have changed historically. That's how we fight for change. And I love that when we're in community with each other as sisters, that we can walk together in our neighborhoods. And part of their work is saying that we walk together in our neighborhoods and we talk about what needs to change. I
Mm-hmm.
mean, I've seen groups of women walking together and thinking about, you know, I feel safe. I feel safer in this neighborhood because, like, there's a band of Black mamas out here, like, they're
Well,
walking together.
there,
They're
no
not
one
taking
with
any
us.
meds. Yes, they're coming together and walking together.
Yeah.
And I think part of that community too, and we didn't really talk about this, and I think it's not as talked about, but we know that stress worsens your health. I mean, I'll just say that.
Yeah.
Uh,
No, it's true.
you know, And so I think part of that walking in community with each other and having a place and a space and a time for yourself in community is really a beautiful thing and a helpful thing. And it doesn't have to be through Girl Trek, but I'm just saying the idea of walking group,
Opportunity
yeah, a
to
walking
visit.
group is an opportunity. And that might not be for you, but if that's something that's free that you can do. And then the
Right.
other side of it is we think about that's exercise. That was just an example, but nutrition, right? So,
Well,
and I said,
let's talk about it in terms of like, so we've talked about cardiovascular, but let's talk about it in terms of hypertension. What can a woman do to reduce her risk for hypertension? And we know that sometimes these hypertensive disorders come as a case of pregnancy, but you're more at risk if you have a history of hypertension, if you have a family history of it. So what are some things that can be done to reduce that risk, whether it's exercise, whether it's food, like what could be done?
Yeah, so I'll say something that people don't like is that we are still learning more about things like preeclampsia and hypertension in pregnancy,
Okay.
and what are the causes. But we know that there are things that we call risk factors that increase your chance of having this. And one thing is, and I know it goes back to this bread and butter stuff that is, it's the same story, but having overweight or obesity and diabetes are actually risk factors for having hypertension in pregnancy. And when you look at how do you reduce your chances of having high blood pressure or diabetes, well, it's interesting that weight loss actually, if you're overweight or obese, weight loss actually reduces your risk of all these things, diabetes, high blood pressure, et cetera, which is why I keep talking about lifestyle and exercise and diet. And it's not like a lot. I mean, I think we know that clinically, even a 5%, 5 to 10% weight loss, it's meaningful for reducing your risk of some of these diseases. So it's not like I'm telling people, go out there and lose hundreds of pounds, because it's not that easy. It's hard. And
So
it's hard.
You said 5% weight loss can make a massive difference in how like a pregnancy related outcome.
I'm saying that 5 to 10% weight loss can make a clinical difference in the risk of the disease. Yeah.
Okay.
And I'm not saying that it is going to take it away, but I'm just trying to stress the point that when we're talking about these things, it's not like you have to lose hundreds of pounds to get a benefit. It's kind of like what we tell people about smoking. Even if you smoked for 50 years, you put down that cigarette and tomorrow you not smoking is going to help you. So yeah, I'm plugged for that too. Smoking, smoking increases complications in pregnancy too. And so a lot of women are motivated to stop during pregnancy. And that's a great time to start that habit of like letting go of some of these things if you're feeling motivated. But, so I just wanted to put that out there that we know that can improve outcomes. And we know there's medications for blood pressure and diabetes and all of those things that I prescribe as a doctor. And some of these medications you need to take during pregnancy. But I also, I'm a lifestyle and obesity medicine physician. And there is, I also want to encourage people. I think medicines are important, but I think lifestyle.
But is coming on.
But lifestyle is powerful. And when I say lifestyle, I mean the choices about our diet and our exercise for people who I know patients who they're like, I don't want another pill. There's nothing you can do to make me take it. I don't want to take it.
Yeah.
That's fine. Actually, working on your lifestyle choices in terms of your food and your exercise, your diet, it is powerful, in some studies, it is more powerful than some of the medications that we give. And so,
hold on, we gotta let people. Y'all hear that? Sometimes your lifestyle changes more powerful than medications. Like
that's right.
Let that sink in.
Yeah, I mean, some of us, and some of my colleagues who do this work. I do research a lot, and I see patients. And there's some people who see patients more than they're doing the research. And there's a subset of us who believe in deprescribing, which means if you can work on these other things, you might not always need to be on all the medications. And so if that's a motivator for people, great, but the things that we talked about, like salt intake, there are special diets. One of them is called the DASH diet for high blood pressure. These are things that we've studied that we know can reduce your blood pressure and substantially. You know, we're talking about 5 to 10 point reductions, which is what we expect when we give people medication sometimes. So that's why I'm saying that it can be as useful. And so those are all things we talked a little bit about. How do you prepare yourself,
Right.
for pregnancy? And as a primary care doctor, or if you're planning pregnancy, we talk about preconception health. It's almost like you want to optimize your health and get ready. We may, pregnancy is like a
I
stress
want to
test.
talk about that. I want to talk.
Yeah.
I think I had a fertility episode some weeks back, and one of the things that the doctors talked about is like preparing yourself, planning for fertility the same way you plan for everything else in your life. And so the same thing, planning for pregnancy. What does that look like? What's some care plans that people can put together if they're like, okay, I do want to have a child in this certain amount of months, years, whatever the case is. What should they be working on now?
Yeah. And I'll also just say a couple of resources. I think the Office of Women's Health, which is something that you can Google at the NIH. I think they also have created some checklists around this. And so that's a potential resource. But, I talk about these chronic diseases. Sometimes as young women, reproductive age is what I mean. And we feel fine. So not everybody is going to their primary care doctor to check out if they even have high blood pressure, diabetes, or those things. And so sometimes women find out for the first time in pregnancy. And we also know that sometimes pregnancy, it is ideal to optimize, but sometimes it's not planned. And so working on health all of the time, I think, is always a good strategy. But if you are planning and you have said, hey, I'm interested in getting pregnant in the next year or two, I would definitely see a primary care doctor, find out where you are with your blood pressure, with your blood sugar, with your cholesterol. Talk to them about your family history of heart disease, your family history of blood clots, because I said that blood clots increase in pregnancy in general, right? But
if you have a history of it,
if you have a family history of it, it's important to know. And this is also, I talk about how you should have these conversations with your primary care doctor if you don't have an OBGYN or an obstetric provider yet. But it's always, I think that we don't do this enough, that we don't have conversations. If you do have a primary care, but they're not your obstetric provider, how do we get those people to talk? And I think advocating for that, because sometimes I know a lot of people actually who do see primary care and they've been seeing people, and that person might even know you better. And it's good for us to talk to your obstetric providers when we can. Another thing that's important is people who are on chronic medication. And I'm not just talking about high blood pressure and diabetes, but some people take medications for depression. Some people take medications for anxiety. Some people take blood thinners for different heart conditions. There's a lot of things. And so we need to make sure that those medications are safe for pregnancy as we're going in, and we might not need to make adjustments of that. And so we could tell you, like, if you're on certain medications and you're planning pregnancy, we need to transition you off and try to pick other things.
So there's a lot of conversations that individuals need to be comfortable having: family history, current medications. Is there some way for people to get comfortable having these conversations, especially if they're not having a conversation with somebody that looks like you as their primary care physician? What can they do? What do you encourage?
Yeah, I think that this is really tough because I hate to just say, like, change mindset. But one of the things that I say is that I try to encourage Black women, when they're going to the doctor, you're the customer. And I'm actually supposed to be there to serve you. That's actually in our job. It's supposed to be service. This is what we do. And I think if you have the mentality that I'm here to work for you, that's right. I'm working for you. Then you have a right to ask any question that you have. It'd just be like if you were going in the customer in a store to buy something, you want to know, like, does it work? What's been if you were going to buy a car, like, how did it drive? What are the other people who've driven it done to the car? Like, those kinds of things. And I think that you can try to have that attitude about your health, but I know that it's not easy. But I just try to, even for me, to remind all of the Black women and the people that are watching, when they go in to say that this is my time, and if I don't understand something, it's actually not it's not because there's something wrong with me. It's because that person isn't explaining it in a way that I can understand. So when a patient tells me they don't understand, as a physician, I think, oh, I need to work on how I explain this because it's not understandable. It's not because of them, it's me. So the responsibility to do a better job of explaining is me. And if I can't explain, I need to find somebody who can. Like, that's all that it is. And so I think there's another part of that where sometimes I hear, well, I didn't really know what they were talking about, but I didn't feel like I could ask. Another thing I would say is sometimes in the moment, because it can be overwhelming, sometimes you have these kind of quick visits, is to think about the questions that you are important to you before
ahead of time.
you go to the visit. Because sometimes if you get overwhelmed, you just like, oh, I left and I didn't ask like the thing that I wanted to ask. And so I say, whenever you plan, I think, and also I think it honestly, it signals things like, oh, they came with their questions. Like, I better have my stuff together, and then I know this is difficult because it's COVID, and we're in a pandemic, and it's not always possible for people. But I think when we get out of these times, I think it's if you want somebody with you, and that will make you feel supported, or that'll make you feel like you will have the strength to ask the questions, or you want them to ask the questions, and they don't play games. Whatever you need, I think that you do that. But I know that it's not easy. I know that those aren't the best answers. And the last thing I'll say is, this is during pregnancy, this is with your primary care doctor, this is after pregnancy, this is with your pediatrician, all of it. If you don't feel comfortable, and I understand that it is sometimes difficult to change providers, but if you have the capacity to, and you don't feel comfortable, you don't feel like something's right, just go with what you think, go with your gut. That's okay. I think that people should change providers if they don't feel listened to.
Is that at every stage, pre, during, and post? Or is there at a time where you think that, just stick with it until you can switch because you're in the middle of the care?
No, I don't think that that's true at all. I think if you have a bad feeling and if you are able to switch providers, then you should. And medicine is it's more fragmented than I think that we would like. So I think a lot of people have the experience where they see a lot of different people through their pregnancy. They go to the clinic, there's 10 partners, they might see the same doctor, they might not. People have had that experience. Even in primary care, they come to a clinic, they might see the same person, they might see a different person every week, whoever's there that week. That happens a lot. And so and I know the equally frustrating thing is, like, I found somebody I liked, and you don't always know if you can stick with them. But and also because delivery is, you don't always know when it is. You're hoping that your provider that you formed a relationship is going to be present during the delivery as well. And this is also where, for pregnancy at least, I think doulas are just so underutilized.
Yes. How important are they to making sure that Black women are truly cared for throughout the birthing process? And
I mean, I'm a fan, and not just like, I think that it really matters, I think that the work that they're doing is really underappreciated, but I think that their presence and, just the intention and the love that they're bringing to this work, it's important, it's needed, and I think it makes a difference in the lives of Black women, in particular. A doula is like a helper of women, and I think just having somebody who can be there for you, and they're not thinking about other things, just for you, I think is very powerful. And I'm not a doula, and I just work closely with them. But I was actually watching some of the testimony from, there was a roundtable talk this week with our vice president. And there was a doula there who was talking about the fact that I think people have this idea that it's somebody who's going to help you bounce on a ball or something.
They have the balls and they're like, breathe.
Yeah, but she's just like, that's not what we do. I mean, we do so much more than that. I'm talking about intention setting. What is the spirit in the space that you want in the room? I do some work around what does it mean to like if you had a sacred birth, if birth was supposed to be everything that you would hope for, and it doesn't always go this way, but I think intention setting is important. Reminding you that you are, that you are the person who voice needs to be heard. And sometimes having that support and that backing can help you feel like you can lift your voice. And then I think there's just other practical things, like if you've never had a baby, you might not know some things, and doulas can really help you navigate some of those things. And also there's doulas, because I think we've talked, pregnancy, we haven't really touched on this, and maybe you had this in the infertility conversation, but unfortunately and very, very sadly, like there's complications with pregnancy. Sometimes we have losses, sometimes we miscarry. And some people don't know that there are different kinds of doulas. There are bereavement doulas who help moms who have had a loss or who've had traumatic deliveries, and have babies who have a lot of complications. That's really overwhelming to be in the ICU with your baby and then having to come home and take care of yourself and take care of your baby. There's postpartum doulas who help women in the postpartum period. So there's been a new call, I think, with the American College of Obstetrics and Gynecology to consider the fourth trimester. So not to say that pregnancy ends in that final trimester, but to really understand that women continue to need care and support. And I was listening to that doula talk, and the doulas that I've talked to, it's not, it isn't just always all about the pregnancy. We talked about these social determinants of health, and I think this is where community-based doulas, or we Black doulas especially, and the work they've done around reproductive justice and understanding that the social determinants of health are so important. And also sometimes what people need, is help finding housing. I mean, that's sometimes what you need. That how do you work on your health? And I've heard women say this, like, I can't think about that. I'm not worried about my high blood pressure. I don't even know where I'm laying my head down. These are important things.
Different stressors that contribute to these chronic conditions that happen, that we have to start really addressing, or else this problem is not going to really go away anytime soon. So, but
which is why
just with you, that we need these conversations with you to continue to advocate for all the women that are going through it.
Yeah. And the one last thing I'll say about doulas too, and this is some of the work that we're doing to, again, structural, trying to advocate. A lot of Black mothers, a lot of Black doulas that I know and doulas that I know have had an experience in pregnancy, and it made them want to become a doula and advocate. A lot of them have their own experiences. And part of the work that I'm doing is trying to make sure that that workforce of doulas, especially Black doulas, gets compensated for their work, because we can't just ask Black women to save other Black women and not pay them. And this is where the policy stuff comes in. A lot of doulas I know are working other jobs, and then they come and do the doula work on top of that because they're not able to make ends meet because of the way reimbursement works for them. And so those are the structural things. We also want to make sure that women have access to doulas, right? Like, if you
is there an association of Black doulas? Is there something that you can share with the viewers right now so that we can put it, in the comments to make sure people know about it?
Yeah, I think that I'm not sure of, like, there's not a place that I know of right this moment that you can just go in and search.
Well, somebody needs to make it. Whoever's out there.
I was gonna flag Health in Her Hue, which is a Black-owned tech company that allows you to search for Black providers. If you're looking for a Black provider, and there actually is, and I don't know if there's a way to make sure that these resources get to the viewers, but I'd love to post something about that, because I think we have ways to make sure that we know where all of the, I know because I'm a physician, like, how do we find out the Black physicians, which is important. But I want to make sure that I talk to my network about is there a quick way to search for Black doulas besides I've done it before for myself, just really looked for doulas, and I just looked to see if the agency or the kind of program they're building seemed to be aligned with what I was interested in. So I look for people who are interested in justice and reproductive justice and choice, because I know that the way that they're trained will be about centering justice in the voice of the people. And so I think that's one way. And then, of course, out in Baltimore, right, in the DC area. So there's a lot of great people doing great work. Mama Toto Village is a big one that people know about and hear about. And, in Baltimore, we have Baltimore Community Doulas. There's a lot of great programs. And so, but I love that. And I'll take that with me too. But how do we make sure that people can find these
For sure.
as well? And I know part of the work that we're trying to do is trying to make sure that our obstetric colleagues also know about this. So certainly you can ask about this from your OB, and the social workers and the people who help to tell you about different services should know too. But I think that it's good to have lists of these things. It's like
readily available.
Yeah.
Help if they can improve the situations, some of the situations we can't get out of. And so if there's something that can just make it a little easier to navigate, then I'm all for making sure that people get that information. So thank you so much for sharing.
Yeah,
I know
absolutely. Health in Her Hue is the one that I will just say off the top of my head.
And we've got a doula in watching the show right now who's based in Nashville, who's like, yes, let's talk about this. Let's get people involved. She's willing to support. So that's why I love these conversations. And I think it's so important for so many people to tune in. As we're wrapping up, what are some key takeaways, like a few key takeaways that you want our viewers who are watching right now and who are watching the replay to take away, whether it's them that are on the pregnancy journey or one of their loved ones or their friends or family members that are on the journey?
Yeah. So a couple of things. I think pre-pregnancy health or preconception health it's so important. And the more that we can think about our health coming into pregnancy, I think the healthier pregnancies that we will have. So preconception health, pre-pregnancy health, talking to your primary care doctor about those things before you're interested or planning pregnancy is really important. And I think it does make a difference. And we try to optimize you as much as we can for a healthy pregnancy. And I'm an internist, so I'm going to talk about pre and post. And I think the same thing. Postpartum is very important, most especially if you've had a complication like high blood pressure in pregnancy, preeclampsia, gestational diabetes. These are things as a primary care provider that can increase your risk of having high blood pressure after pregnancy and diabetes after pregnancy, even if you never had it before. It's important for us to check those things. And we didn't touch on this, but some of these things like preeclampsia, we know they are risk factors for having cardiovascular disease or heart disease later on in life. Mm-hmm. Whether or not you have high blood pressure after pregnancy and everything else was normal, we still know it's a risk factor. And I don't say that to scare people. I just say that to say it just means that you need to check on your health. And that's a summary. I mean, I made this point to say pregnancy is a stress test. It's a time where you were asking our bodies to do a lot. But I also think it's an opportunity. It's an opportunity to really engage and think about our health. And it's an opportunity to find some of the things that we may not have been thinking about when we weren't pregnant. And now our bodies have told us, hey, it might be time to start thinking about these things in the future. So to use it really as an opportunity to really think about your health is what I would say too. So all about primary care and prevention, as much as possible. And the last thing I'll say is that the time in between pregnancies is also, it's also a time that we can work on our health too. So if you already have had a baby and maybe you had a complication before, like you had preeclampsia and you're, worried about if you're going to have it again, that's some of my work. I think working on lifestyle, weight loss, we know might help reduce that risk. And so there's some things that we can talk about and do. And these are the things I would urge people to see primary care, talk to their obstetric providers, work together to think about what we can do in between pregnancies to work on our health. And then as always, and this is almost a call for researchers, physicians, and also women themselves, because I think that when we lift up these stories and these voices, and I saw Black women and mothers talking to our vice president today, those things matter. So telling them the things that you're going through. So I always tell people, whenever you have an opportunity to use your voice, if you can, it actually really, really means something. So just to, just to think about that too.
Well, this is a great wrap up because this is just part one of this 2-part special talking about Black maternal health. And on next time's episode, which is happening on Thursday, we are going to talk about, we're all going to talk to some people who are going through this, who have gone through it, and just hear their voices and talk more about postpartum, because it is incredibly important to hear from other people and know that, you're not the only person going through these situations. So I'm so grateful that you came on today. Thank you so very much. It's conversations like this that are so necessary because it gives everybody that hope that they need. I'm not pregnant, haven't been pregnant, don't have any kids, but I'm like, okay, I have things to think about. And I'm sure there's people that are like me who maybe just have had kids as well, who, are in that year span after having kids, and they probably have found this conversation incredibly empowering as well. So thank you so much.
Thank you so much for having me. And I just want to say that to all the Black mothers that, you are worthy of a healthy and fulfilled life. And I think we're all trying to make sure that we all get there together as Black women, as sisters. And so thank you for this space, and to just keep lifting up these issues so that we can get there. I appreciate it.
Yes, thank you. So for everyone watching today, I really hope that you have found this conversation to be incredibly helpful, and that you will go ahead and share this episode, because I feel like there's so many people who need to hear this and who need to feel empowered and encouraged to advocate for themselves and make sure that their pregnancy journeys are the best that they can be. Remember, healthy pregnancy starts before you're actually pregnant and continues way after. So don't be afraid to, talk to other people and make sure that you are thriving your best, because what is it? Healthy mama, healthy baby, and we want you all to be healthy Black women and mothers. So once again, this is the first of 2 episodes this week about Black maternal health, and I hope you all will join me again on Thursday, because we are going to talk about postpartum, depression, that celebrity snapback comparison that we're seeing, and what is known as the 4th trimester. So thank you all for joining today. I will see you on Thursday, same place, same time. Bye, everyone.